Mm, hungry. I'm hungry for lunch. It's lunchtime.
Welcome. My name is Justine Conley with AARP, and we are welcoming you today to Let's Do Lunch.
And I'm Linda Levin, CEO of ElderSource, the area agency on aging and the Aging and Disability Resource Center for Northeast Florida.
You're watching Let's Do Lunch, a free monthly virtual event put on by AARP and ElderSource. And for the last this is our third month, and we've talked about the importance of voting, participating in the census, and last month we did an art lesson, hoping that art lesson would evoke joy. And so we want to encourage you to go to our AARP page or ElderSource Facebook page to find all of our different events.
Well, fall is here, and so is open enrollment, which is from October 15th through December 7th. This is a time when older adults age 65 and older can look at their current benefit, reevaluate, ask questions, and get some help from the SHINE program. Unfortunately, it's also a time for scammers to access your identity and steal your identity. And so that's what we're going to talk about today.
So today we have with us a guest who volunteers for SHINE, and his name is John Risler. And so we're glad to have John. And SHINE is a volunteer program serving health insurance needs of adults. And he works with the program here in North Florida, and also with the Senior Medical Patrol. And so the Senior Medical Patrol helps prevent, protect, and report Medicare fraud and abuse. So with that, we'd like to welcome John Risler.
Hey, thank you for having me.
So, John, in a little bit, we're going to talk about open enrollment tips. But first, we want to get to the heart of the matter. We want to talk about Medicare scams today. What is Medicare fraud and abuse, and why should we care?
Well, in the brief, simple form, Medicare fraud is the intentional billing of Medicare for services or goods that aren't provided for a number of variety of things. Medical procedures or medical equipment can be included in that. But the key word here is intentional. They bill Medicare and the service was never provided in the first place. Now, Medicare abuse is a little bit different, and that's where the providers bill for a higher rate than the procedure calls for. And that can be a simple coding error, but in some cases it goes on and they get multiple times when they do that. Another thing that is abusive is when they bill for unnecessary services. In other words, they give you 2 or 3 treatments instead of 1 that's required. Or perhaps they give you a service that you don't need at all. And but they performed it, so they bill for it. That's what we call Medicare abuse. So you have fraud, which is intentional for unprovided services, and abuse it's intentional and it's for provided services mostly.
Okay. So thank you, John. What can people do to protect themselves then?
Okay. Perhaps we ought to look at the size of the problem first, okay? This is $1 billion problem, because you did ask in the first part, so why we care? Well, we care because it costs the government a lot of money, and that's money that could be used to treat seniors in the future and keep the thing financially sound. Second of all, there's higher premiums. We have to pay for Part B, a higher cost because the fund doesn't have the money. And finally, it can result in false records, where your record will indicate that you had some treatments that weren't necessary. Should you change providers and the record go over there, they would have a false record of what actually happened to you. So we really need to all care. And that's why we can get into protecting ourselves. There are a number of things you can do. The first thing is to treat your Medicare number like a credit card. That is the way that Medicare knows to bill. It's the key to the storehouse, so to speak. You want to keep that in a separate place. In the house, in a locked place, I would only take it when you go to a provider. Don't carry it in your wallet. And I would bet that most of our listeners right now, it's in their purse, in their wallet, or in their back pocket. You should also audit your Medicare summary notices. These are sent to you periodically, and they provide you a list of all the things that you've had done in the last 3 or 4 months, and you can monitor that closely to protect yourself. Another thing is do not give out your number on the phone. Medicare will not call you on the phone. Medicaid doesn't call on the phone. Most law enforcement agencies don't call on the phone. So when you get that call, be suspicious and don't give out that number for any reason. Okay. And those are some of the ways you can protect yourself. And we can get into others later.
Okay, could you give us some of the most common ways that people have been scammed and how they use Medicare as a doorway to get in?
Okay. There are a number of different scams. The most popular one in the last year has been the swabbing of your cheek to test for genetic tendencies to get certain cancers. Before the COVID shutdown, they would go to health fairs. They'd be standing there in scrubs. They would offer you a free Medicare paid for swab test to find out if you're susceptible to cancer or allergic to certain drugs. And of course, who wouldn't want to know that? So all they do is fill out this form, put down your Medicare number, and they'll send the results to your doctor. Okay, that's the last you're going to hear of them. They're going to bill Medicare for a test, some phony, well, not phony, real, but bribed doctor for $100 a signature will authorize that on a form to Medicare, and the bill to Medicare runs around $10,000 to $11,000 per swab. Okay, wow. Now there's a lot of people in the pyramid that get a slice of that, including the guy at the health fair who probably got $300-400 for each swipe he did during the day. That's a common one. Another one is usually done by phone and involves orthopedic braces, knee braces, elbow braces, ankle braces, and who in a senior doesn't have a pain here and there that a brace might soothe, okay? So they'll call on the phone, they'll try to inquire if you have an ache and a pain, and then they'll say, well, we can get you a Medicare provided brace for that sore knee. And what's the mailing address? What's your Medicare number? What's your phone number? You know, they go through this litany of questions, and in the middle of there is your Medicare number. Well, the next thing you know, on the front porch shows up this box, and it's got a knee brace in it. And for the next 4 or 5 weeks, boxes are showing up every other day till you got a pile of boxes in the garage of all these braces that you don't really need. Another way is an unnecessary procedures. There was a doctor in Miami who was doing eye surgeries that weren't necessary. People didn't get a second opinion. Oh, they trust their doctor. I mean, he says, I need this, I'm going to have it. And the next thing you know, they've had an eye surgery and the bill was charged. And the guy maybe even didn't do it. He faked it. I mean, it's incredible what they'll do. Trying to think of, another one they do is, we're calling to update your Medicare records. Okay. Yeah, well, you want to be sure that your Medicare records are straight, because, when you need Medicare, you need to have good records. Well, they're going to check on your records for sure. Once they get your number, off they go to a physician's assistant or a doctor sitting on his couch, watching football, signing these orders and sending them off to Medicare. Let's see, there's sometimes it involves drugs. People who are hooked on opioids often get caught up in this. They're looking for a supplier. Guy calls on the phone. Sounds legit. Next thing you know, they show up in the mail, a whole bottle of OxyContin. And just now, of course, you get your bottle, but they probably billed for a dozen bottles that never show up anywhere. So those are some of the common ones that we've seen here in Florida.
John, some of this might sound to somebody like it's harmless. So what? I get my cheek swabbed. But really, there's a lot of harm done there. One is the financial ripoff that's taking place of the government resources that could be better spent. But the other is, in that example you shared with me before, that particular situation when they do the genetic testing, it's one test in a lifetime. And people might not know that. And then when they do need that test, they might not get that. Is that correct?
That's correct. And Medicare limits the testing that way to one particular set of circumstances. And once you've had the test, they only pay for one, because that's really all that would be needed in a true situation. So that is difficult. And unless you think that these people are far away, recently there was a huge bust, the largest in history. It was a $6 billion multi-state case. It came down at the end of September. Involved 345 people. 100 of them were medical people. One of whom is a Jacksonville emergency room physician.
Really?
So it doesn't have to go very far to find this. In one case in South Georgia, the one particular woman was involved. She billed $3 million worth of braces, and her superior, or up the line, accounted for $1 billion worth of knee braces over the course of 4 or 5 years. The good thing is that the Department of Health and Health Services, HHS, they have it's called the OIG, Inspector General, and they're like internal policemen. We work closely with them. We feed information that we gather to them, and they work then with the FBI and the Department of Justice to bring these people to court, and they get sentenced. One guy in South Florida, 22 years, a doctor and in federal prison, you don't get out until your sentence is over. There's no parole in the federal system. So the risks for these people are great, but you can see there's a lot of money involved.
Yeah. So I have a question, John, just kind of as a follow-up. So what would someone do who think they've been frauded? How do they report someone if they've been a victim? What are some of the things that they can do, or where do they report? Where do they go?
Okay. Before you report, the first thing you should do is gather all the paperwork you have that you think indicates that something's going on that doesn't smell right. That includes any billings from your provider. the Medicare summary notices, or MSNs. I also recommend that you keep a calendar of your appointments, either in a journal or on a physical calendar, so that you can check off on the MSN and see if every one of them was real, that they billed for. Once you have that together, you can call the Senior Medicare Patrol, call through ElderSource, Shine. You can call or go online and report things through the websites for Florida Shine or ElderSource, some of which are running, I think, at the bottom of your screen.
Yeah.
And if it comes to Senior Medicare Patrol, we're going to call you. We're going to go over the paperwork. In the old days, we used to meet face to face, and we still will sooner or later. And we gather information that you have. We, from our experience, know where to look for more information. And when we gather all of that information, we report that through a federal communications computer system. And the OIG then can see that and share it with the FBI. Because these scams are going on all over the country, and they get from Senior Medicare patrols all over the country bits and pieces, and they weave them into one big picture. And then they're able to really put the manpower on it, because it's not just one little case. It's now interstate, crime. So the other place you could call is the FTC, especially if you're getting phone calls. I have one client recently who had gotten 8 phone calls in 2 days from various places. And of course, when I checked the numbers, she wrote down all the numbers. Fortunately, she didn't tell them her Medicare number. They all come back meaningless. These people buy phone numbers from disreputable sources, sometimes even reputable ones, but they hide their identity very well, and they switch numbers constantly. So the FTC, Senior Medicare Patrol, you can also call the Medicare 800 number and report it through Medicare.
Right.
AARP also has a fraud watch network. And it's not, I don't think it's even on the bottom, but that's another place that you could go to report a variety of scams, because Medicare is just one of the ways that people try to scam seniors. So, Linda.
So, yeah, thanks, Justine. And John, when people ask me a Medicare question or a Medicare fraud question, I tell them, don't ask me. I'm not the expert. You need to talk to our Shine and SMP volunteers, because they are so knowledgeable, so well trained, so fantastic at what they do. We mentioned it's open enrollment time. So where do people call to get guidance about selecting their Medicare plan?
Okay, you can call the Elder Helpline, which is at the bottom. You can go on the Shine website, the Florida Shine website. If you call the Elder web number, that call center will then forward those calls by computer out to the volunteers. I happen to work in St. Johns County. We have 11 volunteers in the county, and they spread those out among the 11. Then that volunteer calls the client or the beneficiary and decides, they decide what kind of problem they have and whether they can be of assistance. So that's where you go to get help, because starting today, October 15th, today we all wait for in Shine, we hope our phone calls go up, because we're ready, willing, and able to help. And now through December 7th, you can review your coverage. I encourage everybody to review their coverage, because you forget, you get comfortable. Maybe you didn't get sick, fortunately, during the year, didn't have to use the coverage much. Or on the other hand, maybe you had to use it a lot and it wasn't what you were hoping for. So review the coverage, see if it's what you think you're going to need for the next year. Then you can evaluate it, compare it with other coverages, and then you can change. Between now and December 7th, that change would be effective on January 1st. Okay, so the Shine volunteers are equipped computer-wise and training-wise to know what you can do, when you can do it, and who you can do it with. We don't recommend or endorse any products or any companies. We may steer you towards economic benefits, a cheaper plan that will get you more coverage, but it won't be specifically by one company. It may be more like by type of plan. So that's the kind of thing we do. We can help you with a drug plan. We can help you navigate the Medicare.gov website. It's an excellent website. I used to say it was the website that worked, as opposed to the other website that crashed. It's quite intuitive, easy to use. If you can order from Amazon, you can work the Medicare website. You can also, we encourage you to set up a Medicare.gov account, mymedicare.gov account. That way you can check your MSNs anytime you want. You don't have to wait for the mail. And if you think that that last doctor was a little shaky, you can go in there a week later and see if the billing's on there. So that's a really good thing for everybody to do. And we can do that for you, or we can help you do that any time of year, but now especially through Medicare open enrollment period.
Right. We got a question in asking if the Shine service is free. Is it only available in Florida? She has her mother living with in another state, and she also wants to make sure that she gets similar help.
Okay. It's free all over the country. A Shine volunteer in Florida can help you in any state. I've helped many of my former workmates in California as they resign and retire. We also have people who live in Florida whose daughter, son, relative lives out of state and is looking for help. So state lines don't matter. However, every state has an organization like Shine. It's called SHIP, S-H-I-P. We have it called Shine because when Shine or SHIP was invented, SHIP was already in use in Florida as an acronym. So we invented Serving the Health Insurance Needs of Elders as a name for our SHIP. So yes, it's free, it's available, it's in every state. It's just look it up on the computer and they'll give you a number.
And the helpline can also give that number out if people call the elder helpline. It's also unbiased. I just wanted to highlight, besides it being free, it is unbiased and a tremendous help. Justine, anything else you'd like to add? You're on mute. Justine, I can't hear you. The technology.
Sorry, I had outside noise and I muted myself. But when do you run into people who have been frauded, but they're too embarrassed to do anything about it or say anything? Why would you encourage people to come forward or at least to report it?
Well, first of all, when you come forward with the information, it's not like you're going to be on the witness stand at court. Okay. Just give us the information. We'll let the professionals build the case. And most of these cases are built on paper trails and financial trails and not on personal testimony. So you don't have to fear the people coming back to get you. So I would say put that fear aside and come forward. And oftentimes, yes, your name will be associated with my report going up the line. Yes, they may call you, but it's highly unlikely that they'll use you as a witness. They have plenty of other evidence in these cases. And it really costs you as a taxpayer money. We're talking $6 billion just on this case this year. And last year SMP people were involved with $2 billion worth of cases. So it's a lot of money, and it's money that we need to save and use for medical care and not for lying in some guy's pocket and buying him fancy cars. And I've tracked some of these people on Google Earth. They have lovely homes. They have boats in the backyard. Anyway, I won't say what cities they live in, but I've actually touched the front door of one of their offices down in the Tampa area.
Wow.
It's ironic. It's just a little off tail here. We were having a Shine conference at a hotel down in Tampa, and I had tracked this guy who owned the company that was doing the lab testing for these swabs to an office building that was right across the street from the hotel.
Wow.
And so I went over, and unfortunately, because the conference ran long, it was closed, but I actually touched his front door. So,
Wow. Wow. Well, I think what's important too to let people know, so often older adults are afraid of the stigma of reporting, of appearing like a victim, that they should have known better, that someone might question their capacity to understand what's going on and not able to make decisions. And that is so not the case, right? These people are very sophisticated, and they have all kinds of people.
Predators.
Yes, they're awful. They're very sophisticated. They get all kinds of people. And it's so important that we knock down that perception that older adults are have anything to fear in terms of their own capacity because they got scammed. And it's an opportunity for them to right a wrong. If for nothing else, they should report it, right the wrong, and hopefully not feel bad or embarrassed about that.
And the pandemic, so I think a question about the pandemic. How have you seen it happen even more so with people being home a lot?
Right.
Yeah, they're doing a lot more by phone now because the health fairs are shut down. Yeah. Large crowd gatherings, they do by phone, they do by mail, but mostly now by phone. To talk to you about who gets scammed, one of my best cases was reported to me by a retired New York City homicide detective. And if you would think someone ought to know a crime when he sees it, he got taken, he and his wife both, but they finally said this didn't smell right, so they called. And we don't judge anybody that calls. We're happy to have something to put our hands on and run with. So you won't get any judgment from me when you call.
There you go. There you go. We have one more question, Justine. I'm sorry.
No,
yeah. Someone was asking for when they call during open enrollment with questions and looking for help to evaluate their plan, what kind of information should they bring with them to that call? What should they have available that would be helpful?
They should have their Medicare card. They should have any insurance cards that they currently have, such as for Part D or for a Medicare Advantage plan. We need to have that information so we have a place to start. Mm-hmm. Okay. They should know what their annual income is. Okay. And they also should have, if they have a list of the drugs that they take, that would be very helpful because it's easier to evaluate a drug plan. If you can put all the drugs in, it gives you a cost benefit analysis.
What about, and their doctors, should they have their doctors listed? Because some may have multiple doctors, maybe on different plans. I don't know.
Right, because that is a situation they're going to have to look at. Does the plan and the doctor match? Okay. Which one is more important to them, the doctor or the plan? Those questions are often things we deal with.
Okay, great.
I had one last question. So when you receive these braces or different things in the mail, is there any recourse to either send them back or to get reimbursed through your plan or something with that, or you just out of luck? How does that work?
I would like you to save the package, take pictures of the mailing documents, and call us.
Okay.
Don't throw it out. Medicare is already paid. So there's no way and it doesn't come out of your pocket. We can get your record corrected afterwards, but the most important thing, if you get brace on the front porch, call us right away, take pictures of it. We'll help you get it to the OIG, and that's very helpful because you track down where they come from, and that helps.
Wonderful. Wow. Take it away, Linda.
Well, we want to thank you, John, for today, and we want to thank everyone who tuned in to watch and get this wonderful information. We hope you will join us next month, the third Thursday at 12:30, and join AARP and ElderSource for Let's Do Lunch.
Thank you.
Thank you for having me.
Thank you for being with us today.